Okay. Welcome to our third live stream with Rio Blanco County Public Health Director Alice Harvey. We're going to talk a little bit and do some Q&A about the current situation with coronavirus and what's going on here. Thank you, Alice, for taking the time to visit with us again on a Friday night when we should all be at home. Let's start with the announcement that the county received approval for its second variance request from the state. What's that mean for residents?
Absolutely. And I will share my screen here in a second and show you where you can find that entire document, both the request and the approval letter. But in general, my interpretation of this request approval, fortunately, is that we are safe to proceed. Of course, with lifting restrictions here, if we maintain a level of caution, use best practice guidelines this summer to ensure that we're being safe. And in a nutshell, we are different than other counties and unique. So overall, the idea behind the second request was, and I actually used these exact words when I spoke to someone at the state, was that we were hoping to be able to host local level events here with limited out-of-town visitors, allow for community members to continue participating in these activities that were important to our local culture. Because of our size, we feel like we're unique in that our ability to be able to do that in a modified fashion, maybe more so than some larger, more urban counties. So our goal, of course, is to create a safe and modified summer event plan that will be able to go through the summer and help to protect our community, but also allow us to get back to some sense of normalcy this summer. That was the idea in general of the request. And again, you can read all of the details and they seem to approve. So we were approved for the gatherings with the parameters which we proposed. And then in terms of businesses, everything is changing so quickly on the state level as well. So it's hard to keep track. And I encourage people to go to all the various websites, the state website, CDPHE and ours, to keep up. But in terms of businesses, we tried to explain, and you can read how we explained it in the letter, in the request, that a lot of our businesses are just smaller and our capacity limits don't necessarily apply because we're not exceeding anywhere near close to the limits that are allowed in larger places. And you can see that in the letter. So generally, we're asking businesses to limit capacity as long as distancing can be maintained. And now with expansion to outdoor spaces, I think that'll be pretty doable for most, if not all, our local businesses. So that was all more or less approved. The one piece they did not approve was for bars to reopen. They do say they stick to the state guidelines, which is that they have to be serving food under a retail food license. So of course our bar here in Meeker anyway does have a retail food license. So we're working with them to see how that can look and how we can support them in reopening, as that seems to be one of the last remaining sectors. So I think overall good news. And I'm just going to share my screen quickly to show you where you can find that. And then that way people can actually locate the approval letter. Can you see that okay?
There it is.
All right. So if you click on our homepage here and our COVID homepage button, this is where you can find that. So this is the application. This is the first application, second application, and then there's that letter, the decision letter. So feel free to read that. And then while we're on here, I just want to let you know this summer event tab will be really useful if you're planning any kind of summer event. We're also going to use this as a place to show what's been approved and what dates those are happening. So we've got guidelines too. So please check this out if you've got questions specifically about summer events. In general, we're hoping the summer's not going to be normal. It's not going to look the same as always, but we definitely feel that we can do this safely if we're smart. So please feel free to check that out and give us a call if you have any questions about that.
And those guidelines will apply for a private citizen that's having a wedding or a party or a reunion could apply those same guidelines for safety.
Yes, absolutely.
And they don't need to have approval from the county, but they can come to you and ask for assistance if they need it, right?
Definitely. Yeah. We figured this was going to get so out of control so fast. We wanted to have general guidelines that would apply for anyone hosting any kind of event. But for those people who are hosting events on county property or using county resources, right. The Board of Commissioners will approve. And then we are forwarding those plans to the various towns too for some of those town events. But public health is setting eyes on all of them and giving recommendations for any that come through.
Good deal. So since we talked about this, the weather's warmed up, restrictions are lifting. It's easy to feel like everything is normal, but things are not normal. Things are still not normal. We do still need to be taking precautions. Yes.
Yes.
Just the basic stuff that we were told at the beginning.
A lot of it, yeah, and I can definitely talk a little bit about the fact that definitely since we've been just so lucky here, and I say lucky, but really truly we get a lot. Our community gets a lot of credit for that. It's not all luck for doing such a great job, but we're definitely not out of the woods. It's not going away anytime soon. Obviously, at this point, we've learned to adapt pretty well. We've done a really good job at practicing these recommendations, but the summer, of course, will bring new challenges that we didn't have this winter. So it wouldn't be wise to think we're immune or that it's over. We are still expecting to see cases here this summer as travel into the county increases. We've already seen a increase of travel into the county. We're actually tracking on the state level. They're tracking GIS data from cell phones, which is a little creepy, definitely. But so we can actually see over time where people are traveling from into Rio Blanco County. So that is going to be interesting to see. So social distancing is going to continue to be even more important. Mm-hmm. And really, as we know that there will naturally be more interactions, we're humans, we expect that. We're naturally going to be increasing that chance for the virus to spread. So definitely need to be careful and take precautions. There's a big focus on mask wearing right now, and I think we can definitely get into a little more detail about that later. Hand sanitizer and washing hands. We're looking at concessions and how food service will work at some of these events. So definitely a lot going on in terms of the state and modeling for preparing for a second wave in the fall. Mm-hmm. So that is definitely in the expectation that will occur after this increase in travel and gatherings this summer. So
is that second wave likely to, depending on how bad it is that likely to put us back under stay-at-home orders? Or do you think they're going to try and avoid that?
Sure. That's a really good question. And honestly, the answer to that is, I think, as always, the big trigger point that they're tracking. Actually, can I share a graphic really quick?
Yeah, go ahead.
This is really helpful in sharing and explaining this. The big trigger points, of course, now we're not hearing this as much, but is definitely the ICU bed capacity. So what they've been doing on the state level with modeling, this new modeling that's coming out here, they're using different projections, based on different levels of social distancing and various levels of social distancing with different groups, including high-risk groups. And so all of the models show that spike at the end of the summer. But if the general idea, and what I think anyway, what I'm seeing, I'm hearing, is that if we get to that point where the wave is bigger or higher than it is in the fall than it was in April, and we start to reach that hospital capacity number where we're having to make life and death decisions based on ventilator capabilities or availabilities anyway. As you heard in the news this spring, that could very likely be the situation again in the fall. Mm-hmm. So once again, why it's so important that here we're really careful what we do this summer, because then we can hopefully potentially avoid that from happening. And then I assume the variance process will continue through the fall. So should we see an increase statewide, but we still remain low, which is obviously the hope. If we do a good job, then I would assume that would continue. So hopefully we could, if state laws were tightened, we wouldn't have to necessarily tighten back up unless we saw an increase. And the state did give us a parameter in terms of our restrictions and when we might need to tighten restrictions back up, or at least recommend. I don't expect this to happen, but if we were to see, it was an increase of 7 cases in the community within 1 week, that would be a time. And what we would do, the commissioners have decided, that would just mean not that we would, start restricting again. We would get together with stakeholders, hospitals. We'd have a Board of Health meeting to talk about how to proceed and how we might be able to mitigate and keep a really close eye on hospital bed capacity. So,
okay.
We'll stop sharing.
Okay, so let's talk about testing a little bit. In the last, I think it was the last commissioner's update that you gave, We've got good testing on both sides of the county now. For symptomatic individuals, for people who are asymptomatic, which from what I understand is a significant percentage of people who are infected, they just don't have any symptoms at all. Is there a possibility of getting to a point of having community testing for anybody?
Yeah, and actually, I've got really good news regarding that. Testing capacity statewide has really increased. So at this point, we've tested, let's see, I think we're at 100 and about 170 people countywide. All have been negative, as you most know, aside from the one positive we had in April. So we currently do have the capacity to do community testing for anyone who is symptomatic. And also, should we have an outbreak, we do have the capacity to test asymptomatic individuals who have been exposed. So that's something that's really important. I wouldn't have been comfortable with approving some of these summer events if we didn't have that capability. So we'll be doing contact tracing, of course, if we do have an outbreak, a positive case, and that person was traced back to being in an event, for an example. This is where, of course, it's why it's so important to think about your actions while you are at these events. We're allowing them to, or we're recommending that they're safe to happen. But depending on the level of interaction you have with other people, that of course you could see how that could get really out of control really fast. So we will be able to test those individuals who are exposed, who are asymptomatic. And at this point, the most recent statistic, which keeps changing, of course, because again, we're only just now getting widespread testing, is 1 in 4 potentially who are asymptomatic. It could be higher than that. So it's a significant number, you're right. And that is why it's really important to have the ability to test asymptomatic people. And then we're hoping to be able to do even more than that. We're hoping to work with the hospitals and doing some surveillance testing for high-risk cohorts. So that could involve, for example, long-term care staff, healthcare workers. So we're definitely going to be working on expanding testing and doing some baseline weekly testing for some certain groups as well. So
higher risk.
Yeah, exactly.
Yeah.
So,
okay, good to hear. Are those tests that are done here, are we processing those locally, or do those still go to the state lab?
The test, where it's processed, depends on where the lab is that's conducting the test. So for us here at Public Health, it's a CDPHE lab.
Okay.
So we send it off, and they interpret those at the state lab.
And then the hospitals have their own labs that they send things off to, or are they doing it in-house?
Rangeley does have an Abbott testing machine. They received, I can't remember how long ago now. So they have the ability to do some in-house testing.
Okay.
This is all the PCR or nasal test. And then also private labs. So the hospital here in Meeker is definitely using private labs. So they send those off. So it's happening in a variety of places now, and lots more places than it was originally. So
yeah,
that's good news.
Okay. And then that about antibody tests, because that question keeps coming up from people. How accurate are the antibody tests as far as you know at this point?
Yeah, that's a really good question. I get a lot of questions about this, definitely. So, and I think that there's still a lot up in the air about antibody testing, and we get a lot of questions. So the first thing I always say that's important to really understand is that all tests are not created equal. They all have different purposes. So the PCR tests, or the virus tests, the nasal, now we have sputum tests as well, they're only positive during that brief window of acute infection. So of course, they're the most important in terms of disease management, because it's the only way you're going to know if you're sick and or contagious right now with COVID. But the serology test, antibody tests, or serology tests are not effective in detecting acute infection. So they serve a different purpose. They might be able to detect the antibodies, the COVID-19 antibodies, which, indicates you've had it in the past. And so knowledge of prior infection is important epidemiologically as we move forward, to manage it in our communities and understand what kind of immunity levels we have. However, we don't know for sure at this point if a positive antibody test means you have immunity, or for how long. So that's the big $1 million question. We do not know. The results themselves, of course, vary in accuracy. They're not completely reliable. Accuracy rates range. It really just kind of depends on the test itself. I've seen as low as 50% accuracy, and that varies. But the big take-home point is, if you're curious, or you're in a high-risk profession, you want to know if you've been exposed or you had it back in January, Absolutely. Feel free to get that test, and by all means, it can give us valuable data. Eventually it will help us in this research, but won't necessarily benefit you in terms of giving you that clean slate,
Right.
or know that you're safe from getting the virus again, or you can go out and not wear a mask or anything like that. So it's still very up in the air.
So somebody that wants to get one, that's just, I mean, they are dead certain that they had it in January, and they're convinced that they need this antibody test. Do they do that at the hospital? Do they do that through public health?
It is through the hospital, so it would be through your physician who can
Okay.
order those tests. And I know that Pioneers Medical Center is doing those,
Mhm.
so individuals can have that conversation with their primary care doctor, and then choose whether or not to get that test. All the ones that have been done so far have been negative.
Mhm.
We are keeping an eye on that at public health. So that's interesting. And in public health, our role for antibody testing, we do have some. We won't be giving those to the general public. We'll be using those for very targeted testing, maybe probably in the fall. We haven't quite decided yet. We'll work with the community to see where that would be the most beneficial once we know a little more about it. And we'll be working with, high risk groups, for example, maybe childcare workers, healthcare workers, that sort of thing is who we'll be focusing on with our antibody testing.
Okay. Okay, that's good to know. And then on to masks, the subject of most controversy and discussion around town. Uh, so from the very beginning, the information that went out to the public about wearing masks has been confusing and contradictory. I mean, we started out with don't wear a mask, and now it's wear a mask, and you can wear a mask, and sometimes you should wear one, but sometimes you don't need to. And then there's some misinformation out there about whether masks are helpful or whether they might even be harmful. So can we address some of those? I'm sure you've heard a number of them as well.
Yeah, absolutely. And I also realized, Nikki, too, the fact that it's the summer and it was like 90 degrees outside today, this
Mm-hmm.
is really on the forefront of people's minds because some of those cloth masks can be really uncomfortable
Mm-hmm.
as we move into the summer. That's definitely an issue, and I absolutely recognize that. So, yeah, you're right. This is a typical example of information overload. What happens when the public is bombarded with information and it's changing, and it results in this great deal of confusion when actually it's not that confusing. So I'll try to make it as simple as possible. And what it boils down to is this: wearing a covering over your face. Doesn't matter what it is. It helps to protect other people from getting the virus from you if you wear it appropriately. And that means, keeping it clean, not touching the front of it, and then touching surfaces. So it all boils down to understanding how the virus spreads. And I would love to show my screen one last time here because I have this awesome simulation, if that's okay,
Yeah, go ahead.
that I love to use. I don't know if you've seen anything like this. I remember during the norovirus outbreak that we had last year, I saw one of these simulations with vomit and how when you vomit, how far
Mhm.
the germs can spread. I don't know if any of you saw those, and this is
Yeah, we
similar.
all wanted to bleach our entire bathrooms from the top.
Yeah,
Yeah.
exactly. So can you see that okay?
Uh-huh.
So generally, and this is just kind of cool, it's a simulation that really just shows you the what a mask does is it stops these respiratory droplets from exiting and then being spewed out into
Hmm.
the environment. And there's lots of different types of respiratory droplets. So this is, of course, how the virus spreads. There are small ones that really light ones that can actually kind of be they're almost like aerosol. They can hang in the air for up to 20 minutes. Then there's these large droplets, and you can really see this here in this modeling. If you cough or sneeze, there's this wide radius that those respiratory droplets can travel. And so these can also land on surfaces. That's the other thing. The large droplets have the capacity to travel further and then land on surfaces that people might then touch. So that's the other piece. So by wearing a mask, essentially, and then here, let me forward. It's also known now that, even by just speaking, you are projecting some of these droplets into the air. So if you're asymptomatic and you're in a room with someone and you're talking, you have no concern because you're not symptomatic, you don't know you have it. You can still be spreading those droplets into the air. And so by wearing a mask, you're just essentially putting up a barrier. So are they perfect? No, absolutely not. You can see there's definitely, especially the homemade or the cloth masks are not medical grade, and N95 is the only way you're going to get that true seal and not let anything out. So that's not necessary, obviously, for everyone, but you can really see you're just giving the people around you a better chance at not getting your respiratory droplets and breathing them in. So that's my spiel that I always give. In terms of masks, you're right, they're not perfect, but they go a great way. They do a great deal to protect those around you. So that's why we suggest that you wear them as much as you possibly can when you're going to be in a situation around other people.
Okay. What about this? There's a lot of discussion about, well, if I wear a mask, I'm gonna have oxygen deprivation, and this could cause. Is there any proof to that?
No, I mean, I think the big thing there is just to think about if you have an underlying respiratory condition, then obviously, yes, it could be stifling, and especially in the heat. So it's never recommended that anyone wear a mask if it's causing that kind of level of discomfort. So typically, though, a normal healthy person wearing a mask is not going to cause that level of lack of oxygen. It'd just be really uncomfortable. And ideally, you take your mask with you, you have a place to keep it, and you're putting it on when you're in high risk situations versus wearing it just all the time, because that is virtually impossible, especially in the summertime.
So just by way of example, we're going to have a parade for the 4th of July. Should we be wearing masks when we go to the parade?
And that's a great question, because all the event planners are going to great lengths to make this possible for everyone to do it safely. So for example, the 4th of July parade, we're talking about just expanding the route so people have more places to stand. And that's the general take home point for all of these summer events. As long as you can maintain the distance. So whether you're at the grandstands in the rodeo, or you're at the parade, or you're at on the courthouse lawn, if you're able to safely keep that distance, then it's not going to be as important to wear the mask. However, if you're planning to, for example, go up to look at, maybe something from a vendor, you're planning on meeting friends, you've got kids that you're going to be, running around and maybe possibly being close to people, you're going in and out of businesses. Those are the situations when you really need to be wearing a mask. And so outside on the street, if you're watching a parade and you've got good distance between you and the families on either side of you, then no, and not necessary to wear a mask.
Okay. So just maintain that social distance.
Yeah, absolutely.
As much as possible. Okay. So with what's besides the events, what are safe activities for the summer, and what are higher risk things that we should be avoiding?
Oh, and this, one thing I've realized through all this is just touching every area of life. And we all are feeling that so acutely right now. So in general, my recommendation is to just think about the environment. Each environment's unique. So you have to take all of these things into consideration when you're choosing, your level of exposure in any activity. So just some of the common ones that I would avoid definitely would be large parties and get-togethers, where, especially indoors, so any activity where you can't control how close people are to you. So for example, I had a lady call me from out of state, said she had a wedding she might be attending, and what could she do to protect herself? She had a history of some chronic disease. And so what I tell anyone who calls and asks me those questions, I say it's really up to you and your choice. If you feel like, and talk to the event planners, talk to the person's house you're going to, say, am I going to be able to, are we sitting outside on lawn chairs? Will there be a way to socially distance easily? Then great. If it's something where you don't think that's going to be possible, then I would avoid it. So typically, and traveling to congested cities, of course, highly populated areas, I would avoid traveling on public transportation if possible. So those are the things I would definitely avoid this summer. But in terms of your day-to-day stuff, just think about modification. So playgrounds are opening back up, for example, and we all know, let's face it, kids are little cesspools. So, we know kids are full of germs, and they're just at really high risk of spreading the disease just by their very nature. It's not their fault. So think about, for example, if you are going to a play date at a playground, just think about minimizing your exposure risk. So consider having a play date with other kids you and your family typically have more frequent exposure to. Try to make, get smaller groups together versus larger groups. Take some hand sanitizer. Think about the activities you're doing. Get your kids to put hand sanitizer on when they come back for a snack. All these and after they eat, all these little things can really go a long way to making these things safe. You just have to think about how to minimize that exposure risk. So I hope that answers that question.
Yeah, that does, that helps. Which is that whole discussion about personal risk and evaluating, everyone needs to evaluate their own risk and determine what is safe for them to do, depending on their health. Let's see. We had one, I think that answers most of what I had. We had one question that came in through our survey that was pretty intense, and about some varying options for treating, like home treatments, home remedy kind of things with ozonated water or calcium, vitamin K. What was the other one? I can't remember. I thought I had it written down, but it's gone.
Sure.
It disappeared. Yeah. Anyway, there were just a handful of things. Are there home remedies that have any proven benefit for treating COVID?
Currently, as you know, probably there's no, this is a new virus, so we're learning a lot and there's a lot of research going on. There are no FDA approved drugs specifically right now yet for the treatment of COVID. Lots of things being tested. So this question, that was pretty easy to answer in terms of, with my nursing background, because I used to have these conversations with patients all the time. They're all really great questions. I mean, it shows that people are, taking their health seriously and looking into ways they can protect themselves. So that's really great. But basically, in summary, many diseases and conditions, we're discovering all the time. There's a variety of supplements, things we can do, homeopathic things we can do to improve our health outcomes. But they're not necessarily intended to be taken as a curative measure that has any significant effect acting alone in terms of treatment. So this is true all across medicine, and ozonated water is a good example. It's definitely something they're doing studies on. It's been shown to have some anti-inflammatory effects. So like they've studied it in mice and seen that it helps with some GI related inflammation. So, promising and good, but really meant to be, again, could be promising as a supplement or an adjunct therapy, for a variety of conditions. So that's where a lot of that stuff comes from. Similar to like the calcium supplements and vitamin K, all of those things, they're minerals that are found in foods and they're typically used as additives. We get them from our diet. But just like vitamins we take to boost some of our bodily functions and our immune system, they can definitely have health benefits, but definitely not something that would be effective against fighting COVID, the virus itself, should you be infected. Okay. And a lot of the treatment for COVID at this point is treating the symptoms. So I hope that answers that. It's great to be looking into these things, but there's definitely not anything that alone would have has been found yet to have a significant effect. The iodine water is something, and you have to have some caution as well, because of course sometimes it's important to understand how things work in the body. So like iodine water, for example, that's typically used to purify water that you're putting into your body. So you're killing like the viruses, organisms that are in the water. But if you're drinking the water, it doesn't necessarily work the other way around. You're not going to kill the viruses and, replicating in your GI tract. It's in your system. It's systemic infection. So it's not going to benefit you. So you could then actually harm yourself if you did something like drink iodine water and drank too much and had a toxic level, can cause thyroid problems and things like that. So you just have to balance out the risk with some of those benefits. And I'm absolutely in support of people looking up those things and seeing what they can do to boost their chances of being able to fight the virus should they get infected.
Okay. I think that answers all of my questions. Did you have anything else that we missed or that you'd like to share?
Just in general, I know I sound like a broken record right now, but truly this summer is going to bring some really new challenges. And I think the county and the commissioners are just so dedicated to like making this summer happen in Rio Blanco County. And I go to a lot of groups and board meetings and talk to people. And I've just been so impressed with how dedicated these groups are to making this work. Truly, we haven't told people, no, that's not how it's been really at my department. These groups are making these decisions themselves based on what they are willing and not willing to do in terms of posing a risk to the community. So just know that you'll see these activities happening and we encourage people to enjoy them, but just be smart. If we're all smart about it, we're going to be okay. If we have some cases that come in and I can do contact tracing and there's not a great, huge number of people that are not following recommendations that I have to track down and test, and we don't end up with, of course, our hospitals getting overrun, then we're going to be fine. And I definitely going into the fall when we expect worldwide and countrywide to have a spike, I want to continue really, what we had this spring where we're just hunkered down and people are being smart. And overall, I think we can do it. So that's my general message for the summer anyway.
So it kind of comes down to that personal responsibility that we all like to talk about, that if we are all taking responsibility for ourselves and our own actions, we're likely to at least slow this thing down and
Right.
hopefully prevent a major problem here.
Yes, and knowing that, politically, there's lots going on here in our society, obviously, right now. And it's really difficult when you're looking at different sectors, how you decide, why is one business more important than another? Or why can this group do this and this group not do this? And that is so tough. And again, the way I see it truly is, we can reopen and we can support our businesses in reopening by following the recommendations. And
Right.
so you're a patron, I feel like you have somewhat of a responsibility in a way to support your business and being careful, just like they have a responsibility to protect you as their customer. So if people look at it that way, versus, just kind of throwing caution to the wind, okay, everything's fine, this is all a hoax, which hopefully at this point with, the amount of deaths we have, I don't see how you could believe that at this point, but that attitude won't go anywhere to helping our community reopen is really what I'd like to try to emphasize. Even if, despite your opinions, just generally taking precautions will help everybody in all of these different situations where people are honestly struggling.
Right. Okay. Well, thank you so much. Thank you again for taking the time to talk with us and share your knowledge and your information that you have on this, and hopefully we'll have a good summer, even if it will be different.
Right, exactly. So thank you for having me.
Thank you.
Anytime.
We'll talk to you later.
All right, bye-bye.
Bye-bye.